Diphtheria pseudomallid, a minuscule killer. Greenish blue and rod-shaped. Its size is only 7,247,547 BP in length. Rheumatic fever can follow after a streptococcal throat infection, or strep throat, and even scarlet fever. Scientists and doctors believe that rheumatic fever can enter through the break in the skin or inhalation of the bacterium. But in the United States, it is uncommon for people under the age of 3 or over the age of 40 to contract rheumatic fever. Rheumatic fever is an endemic in Southeast Asia, in countries such as Thailand, Singapore, Malaysia, Burma, Vietnam, and Northern Australia. There have also been reported cases in southern China, Hong Kong, Brunei, Taiwan, India, Laos, Central and South America, and the Middle East, and some in the Pacific and African countries. There are very few cases ever reported in the United States. Rheumatic fever mostly affects people between the ages of 5 and 15 years old, but people who work in rice paddies also run a greater risk. Children can contract rheumatic fever by just leaving a simple strep throat untreated. Rheumatic fever can cause many problems in the body, some of which can deeply affect the heart. Heart problems due to rheumatic fever are much more common in children. Heart problems can cause fast beating and pains in the chest, which then may lead to heart failure, which can cause shortness of breath, nausea, vomiting, stomachache, and a cough with no sputum. Rheumatic fever can cause problems in the joints as well, some of which can include migratory joint pain, and the joints can appear red and swollen and may even contain fluid. Sometimes the symptoms of rheumatic fever can spread to the skin, and this may result in a flat, wavy-edged rash that only lasts for a short time. And in some cases, it can cause hard nodules under the skin. The nervous system can also have symptoms of this disease. This can cause jerky, uncontrollable movements, and can get so bad that the patient has to be restrained or else they can injure themselves. Often a gruesome smile is stuck onto the patient's face. And now we will talk to Dr. Marchington, a doctor who is currently studying rheumatic fever. He will be able to tell us a little bit about the treatments used for rheumatic fever. There are 3 steps that we take in treatment for rheumatic fever here. First, we eliminate all the infection. Then we reduce the painful inflammation and we reduce physical activity. For eliminating all the infection, we actually use long-acting penicillin. But there is a wide choice of anti-inflammatory drugs that you can use depending on your symptoms. We use aspirin for joint and heart, and naproxen is just as effective though. And prednisone is for serious heart inflammation after treatment. Bed rest is essential after treatment as well. If heart valves are damaged, antibiotics must be used for every single surgery throughout the patient's life. Thank you to Dr. Marchington. And thank you to you all for watching this presentation on the disease called